To assess hip internal rotation, we're going to need a foam roller. If you don't have one, a yoga block would work, or a pillow that's just really firm. So I'm going to demonstrate with my head toward the camera because I think it's visually a little easier to see. And that's the angle that I would take any sort of progress picture for monitoring or assessing how well my hip internal rotation has changed. So I'm going to find my way onto my back, and then I'm going to take the foam roll and place it right between my thighs. So I'm just keeping some gentle pressure there. And when I'm ready, I can have my hands on the ground to brace me. I'm going to bring those feet off the ground. So now my knees are bent at 90 degrees, my hips at about 90. So we're going to focus on one leg at a time. We're going to start with this right leg. Left leg stays exactly as it is. The foam roller is ideally going to stay in space exactly where it is. So we're not going to let it move around at all, right? Keeping left leg exactly stationary, foam roll where it is. We're going to imagine the right thigh, the right femur is a flagpole that rotates, all right? And so our lower leg and foot is the flag. So we're going to rotate that thigh bone in, which is going to bring that lower leg or the flag out. So this is looking at internal rotation at this right hip. We want to be sure we're not moving anything on the left. It can be helpful to do this against a wall, but even then we can still substitute. So just be conscious of that. Then we'll look at the other side. Now I'm going to keep my right leg stationary. This left one acts as a flagpole, and I rotate out. And I'm looking, are there any differences in how this feels side to side? Can I only get so far on one side while I get really far on the other? How does it feel at the end? Does it feel like no problem, really smooth getting to the end, or kind of sticky? These are things to take note of. Once I check internal rotation there, I like to flip on my stomach. We can place the foam roller between the thighs again, just to sort of help keep our thighs honest, so to speak. And then looking at one leg at a time, I'll bend, and I'm going to, again, let that leg come out to the side, but try to not let that foam roll move around too much, and bring it back in. And we could even have both legs bent for this, actually. I don't have to have them straight. And if we're looking at the other side, how far can I bring it out? How does it feel to me? And this is a great angle to take any sort of progress photo to see how well our hips are moving into internal rotation, both on the stomach and on the back.